But let's stick with the theme of the NHS, shall we? We all know pretty much it's in a bit of a mess at the moment, don't we? And by the way, I'm not knocking a frontline staff. I know that doctors and workers and all the rest of it work very hard. I'm talking about the concept of the organisation. Over 7 million people, for example, on waiting lists right now. It's just not great, is it? Let's be honest. Bed blockers, it's a horrible term, but I do think there are so many people in hospital that, quite frankly, do not need to be there. About 13,000 people hit that bill, tick that box, should I say, recently. That's just one number. And I think to myself, look, if you didn't have those 13,000 people taking up the beds who are not in medical need, they don't need to be in hospital, they could be out and about, but there's just not the services or the capacity or whatever it is to discharge them. If you did that, I think that would be a first step in trying to resolve some of these problems. So I've put my thinking caps on, gents. I've come up with a very simple idea. I partially floated it the other day. If Steve Barclay's listening, he can have it for free. And if they implement it, I will say that they've stolen it off me. Remember those Nightingale hospitals that we used to have that were knocked up quicker than a quick thing in Quickland during COVID? Set those back up again and draft in the army, and I know people won't be happy with this, but draft in the army temporarily to get these people out of hospital, comfortable, free up those beds, and away you go. It'll give you some breathing space to sort out the issues going forward. Yes, you need reform, but I think that's a great stopgap solution. If I say so myself, I want to pat myself on my own back, but I can't. I'll knock my microphone off. What do you think?
I actually think it's a really interesting idea. I don't know about using the army. I know the military chiefs are really wary about the army getting called in for more and more stuff. But the Nightingales thing is really interesting because what the Nightingales were, they were called hospitals. They weren't really fully equipped hospitals. I think they were referred to dismissively by someone as ventilation centres. But they basically provided one form of care. Now, bed blockers, which is an ugly term, but it's...
I know, it's not nice. I do apologise if you're watching this. You might be in a hospital bed watching it now, shouting, telling me who do I think I am, but...
But it is the term. These are people who don't need the sort of care that a hospital is on hand to provide, but they need to be basically looked after. So the idea of a Nightingale would actually be, I think, relatively well suited to being a kind of outpatient warehouse, if you like. Basically, you get people...
That's even worse than my term.
No, but I mean, it's structurally, structurally, that's what it would be. It would be, you've got people out of hospital where they don't need to be in close proximity to, advanced diagnostics and acute care, but they don't have anywhere in the community. So you basically have these big centres which are just there for looking after outpatients and providing a general... I think that could actually really work.
Yes.